Today I'm going to talk about miscarriages, what care to be taken after a miscarriage, and what questions to be asked to your doctor to prevent further miscarriages. Hello everyone, I'm Dr. Prachi Kulkarni, fertility specialist, Ferty9 Fertility Center, Banjara Hills. So first we will talk about what care to be taken after a miscarriage. So we will assume that you have undergone a miscarriage, you have finished the treatment for that particular miscarriage, and now before planning the next pregnancy, what care you should take. So the care what you will take after a miscarriage, usually we advise not to conceive for a period of at least 3 months so that your body can recover completely. This is actually for the recovery of the uterus and recovery of your hormones and also the nutrients or the blood loss that has happened during a miscarriage. So this period usually is 2 to 3 months, but if the miscarriage is like after 6th month, then we may ask you to take a longer break also. So during that break, what you're supposed to do is you have to focus on your general health. You have to eat a healthy nutritious diet which is rich in proteins and multivitamins and antioxidants. So you should take good quality plant proteins like pulses, this sprouted pulses or legumes, or even paneer or dairy products. You have to take iron calcium supplement if doctor has advised. Also you have to take folic acid supplements or B complex supplements so that it will help your body to recover. So this was about the diet and the multivitamins part. What else you should do in this time when you're not supposed to conceive is you have to practice a proper contraception so that you should not end up with a pregnancy when you don't want it. So after a miscarriage you have to use either some tablets like oral contraceptive pills which are prescribed by your doctor, or you have to use barrier contraception like condoms so that you don't end up with a pregnancy when your body is not prepared for it or when you're not planned for it. So second thing is contraception. Now third thing is what you should do in between this period is get yourself evaluated as your doctor has advised for either for the cause of miscarriage or for the next pregnancy planning to prevent any miscarriage. So now coming to the point, what questions you will ask to the doctor when you had a miscarriage. So the questions to be asked is what could be the probable reason for this particular miscarriage. So once you know the probable reason, then you can ask what I can do to prevent this from happening in future pregnancy. So not all miscarriages can be prevented, but there might be some reasons in a miscarriage which we can advise you to do something so that we can prevent it from happening the next time. Also, if you have had recurrent miscarriages, then there might be certain issues which we have to take care of before you plan your future pregnancy. So these issues can be either genetic issues, or they can be related to immunological issues, or they can be related to the uterus. So these issues needs to be evaluated before you plan the next pregnancy. So if your doctor advises any particular blood test, so that these blood tests can help us decide if there was any immunological factor associated, or sometimes also some hormonal imbalances can cause these miscarriages. So your doctor may advise hormonal evaluation. Sometimes even high blood sugar can result into miscarriage. So finding out what is the cause for this particular miscarriage. Is it hormonal? Is it because of high blood sugar? Is it because of some genetic issue or immunological issue? You need to get those tests done as advised by the doctor, and visit the doctor again with the report so that doctor can help you plan better the future pregnancy. Because as you have repeated miscarriages, there is always a chance of infection which may occur during the miscarriage or after the miscarriage, which may result into the uterus being not favorable for future pregnancy. Like these infection can damage the lining of the uterus, so that in future the lining may not grow as required, or there might be development of some adhesions, like what we call it, the walls of the uterus may stick together to each other, so it may not allow the implantation of future pregnancy. So since we are talking about uterus, then what are other causes which are related to the uterus? So these causes can be either congenital problems, that is by birth some problems with the uterus, or it can be acquired problems, means some issues which has happened after your birth or during your reproductive life. So what are the problems which may be present from birth? So these problems can be related to the shape and size of the uterus. We call it congenital uterine anomalies. So it can be either like unicornuate or bicornuate uterus or a septate uterus. So these uterine anomalies can cause miscarriages. Now, what could be the acquired cause of miscarriages? As we already discussed, it can be the intrauterine adhesions where the walls are stuck together, or it can be very thin endometrium, or it can be sometimes like growths of the inner layer of the uterus, which is called endometrial polyps. So these polyps can also cause miscarriages. There can be fibroids in the uterus which can cause miscarriages. So the fibroids, especially those which are going inside the uterine cavity, they can cause miscarriages. So you need to have a proper evaluation of your uterus, or you have to have blood tests to find out if there is any immunological cause for the miscarriages, any genetic cause for the miscarriages, any hormonal cause for the miscarriages. So if you have recurrent miscarriages, then you have to visit a fertility specialist, where the fertility specialist will evaluate all these factors properly. So you have to ask these questions: do I have to take any test after my miscarriage, so that we can plan our future pregnancy better? And you should ask, is there any chance of this can happen it again in future pregnancy? What precautions or what medicines can we take to prevent it from happening, or do we need any particular treatment based on these reports, so that we don't end up with a miscarriage in future pregnancy? So the treatments will vary based on the cause, and your fertility specialist can guide you better to have a healthy baby. I hope this was helpful. I am Dr. Prachi Kulkarni. You can contact me at Ferty9 Fertility Center, Banjara Hills. Thank you.